what's your secret? You got the kind of vibe that leaves men speechless. It could be model multitasking genius. Yeah, you got it all.
Alrighty, welcome to Breakthrough Conversations, where we explore the stories, the mindsets, and the strategies that help leaders and organizations move from intention to impact. Today, I'm so excited to welcome Katie Nowak, a healthcare strategy and operations executive who sits at the powerful intersection of clinicians, business, and technology. Katie is currently a vice president of commercial accounts and brings deep experience in population health, large-scale transformation, and strategy execution. She is known as a creative strategist and systems thinker who helps organizations turn complex goals into measurable outcomes that improve patient and community well-being. Katie leads with both passion and compassion, and her work challenges how we think about leadership, execution, and what it truly takes to improve healthcare from the inside out. And I'm thrilled to have her today for multiple reasons. But number one is because we kind of grew up together in healthcare, and we worked at an organization together on a large-scale initiative. And I've always looked up to her and admired her. I think she's one of the most beautiful people I've ever met, outside and inside. Katie, thank you for joining me.
Rhoda, it is truly my pleasure to be here. You are also one of the most beautiful people that I know as well. So thank you for having me.
Thank you, Katie. And we go back, way back. I actually started at the organization we worked at together in 2007. So I think you started shortly after or before.
Right about the same time. You are exactly
right.
right.
So we've known each other for more than 20 years. Can you believe it? You look the exact same, though.
And so do you. And so do you.
Yes. So, Katie, you've described yourself as someone who's passionate about bringing clinicians closer to the business and technology of healthcare. What first sparked that passion for you?
You know, as I think back as where this passion came from, it really came from me practicing as a physical therapist, which is very early in my career.
I forgot about that. That's right.
And I was documenting by handwritten notes all of my physical therapy plans and treatments. And to be completely transparent, I complained one day to my boss, and he said, well, go fix it and join the electronic health record team, which is how our paths crossed, so that we could figure out how to improve the workflows of our clinicians so that we could take better care of patients. And that's really where this whole passion of mine came from. It always, the work that I do always stems from being able to treat our patients in the best possible manner. And so that's how this passion started way back when I complained embarrassingly.
Well, thank you for that, because it certainly was mission work.
Absolutely. And a wonderful team that we had together.
It was so fun. It was high pressure, but I called it fun stress. I also remember when I had gotten sick in 2008, and I ended up at the emergency room at Lake St. Louis, and the doctor that came in remembered me, and he said, oh no, this is the Epic lady. We got to fix this. And they were leveraging the technology to tell a story to help them get to the root cause. So
that's
I
wonderful.
got to experience the work we were doing in real time.
That's great.
So, Katie, your work at the intersection of patient care, business strategy, and technology, that's three areas that don't always speak the same language. What happens when those worlds are disconnected, and what changes when there's true alignment?
Yeah, so that disconnect between the clinicians and technology and business decisions really is at the heart of patient care. And when those pieces are disconnected, we can't give our best to the work that we're doing. We can't see that patient. And so making sure that all of those pieces, the patient care piece, the business strategy piece, and the technology piece are aligned, allows clinicians to do the best work that they can.
Mm-hmm.
And it's not necessarily about everyone even staying in their respective lane,
Right.
because our paths overlap. As a clinician, we're doing work, we're interacting with the technology
Right.
in order to be able to deliver the care that we are doing at the front lines. And that also overlaps with that business strategy, the why behind it, and how we are getting the work done behind the scenes. So when those three things are disconnected, clinicians and patients suffer. The good thing is everyone has good intent. Everyone wants to work together.
Right.
And when the table is set for clinicians and business executives and our IT folks to come together, then our patients our patients really do benefit from that work.
Yeah, we get the best possible outcome when all three. It's like a three-legged stool. When they're solidified and working in harmony, you can't help but get better outcomes.
And that's why I think we had so much fun on the electronic health record project when we were there together, because we recognized that.
Yes.
Now, we also recognized it was hard work, right? Because we had some folks who didn't necessarily want to come along with us.
Right.
And so we had to work through that and work with through that change management. But when the team understood and when we stepped back and listened, it really did it presented a wonderful environment for everyone to get better.
It really did. And that project on the technology side was very smart of the leadership at that organization to understand that they needed to recruit clinicians like yourself.
Amen.
To be at the front line designing and working with those clinicians to develop the appropriate workflows.
It made all the difference in the world, really. That recognition that they needed to bring clinicians onto our team who were then able to relate to those folks who were on the front lines. I could say, listen, I know I treated these patients. I was documenting on paper. And I see how you're treating a patient now, and you've gone from being able to check boxes on a care plan to do clicks in a computer system. We could relate to the adaptation that needed to happen when we moved from paper to that electronic world. It seems like so long. It seems like yesterday, yet it was so long ago.
Right. And it also, the part you mentioned about the change management piece, that to me was the hardest. And yet none of us were trained in change management, but we had the intuition to know how we needed to, like you said, step back, give the clinicians the opportunity to share what their concerns were, to vent. We understood at the root of that was just the fear of the unknown.
Absolutely.
And so, the change management piece, I believe, was the hardest. And to the point about going from paper to the system, right before I joined that initiative, I was the director of medical records at St. Louis University, SLU Care.
Right.
And we were paper in 7 different sites. And it was scary to watch how the physicians were trying their best to provide a high continuum of care, but they will be missing documents and paper from the charts. And the staff in medical records were young and they didn't understand the importance of it. It was risky. So,
and not to mention a bit dangerous too, when you were trying to care for a patient who didn't have that
full
continuation of care and the full picture of everything that was going on.
So
we were pretty lucky to be part of that phase of healthcare.
We really were. So you're known, Katie, as a systems thinker. And for leaders who may hear that term often, but they don't always see it in practice, what does systems thinking actually look like in real healthcare environments?
Yeah, so I appreciate being known for being a systems thinker. I feel like it's the ability to kind of step back and be able to look at the big picture. Someone who is maybe a little earlier in their career can kind of hone in maybe on one particular problem and not have the even insight or forethought to think, okay, we've got this problem in front of us, but what are the other pieces that are touching this problem?
Right.
And how can we take a step back and look at that bigger picture, whether that's IT
Right.
or even, human resources or pharmacy or supply chain
Yes.
or the medical
The medical
record.
records, right.
How does this all overlap? An example I think in my world today is when we're faced with a drug shortage and a patient isn't able to get the drug that they need.
Right.
Uh, a newly formed leader or maybe someone who isn't a systems thinker would think, okay, well, they're not getting that drug because the pharmacy's not delivering it fast enough. Well, for those of us who are working behind the scenes and who are thinking about this issue from a much broader perspective, I mean, we're going all the way back to the manufacturing of that drug and what is going on there.
Right.
Or maybe there's technology in the middle where we're not talking to one another, so that manufacturer doesn't even know that there's a need on the front lines for a drug. So, there's a lot that a system thinker needs to take into account. And when we move from just the immediate fixing one problem to being able to kind of zoom out and look at the entire situation, you can really function at a much higher level with systems thinking.
So well explained. What a great example you provided, too. You're such a clear communicator. You've helped organizations turn complex population health goals into measurable results. What are the biggest barriers that leaders face when trying to move from vision to execution, and how do you help, teams get unstuck?
Yeah, you bet. Well, this is a situation that I have actually been able to work on both sides. So since I've been on the front line of healthcare, I've been in that execution piece, and then I've kind of been behind the scenes also. And so I feel like where we run into trouble from a leadership perspective sometimes is that our goals are just simply too abstract.
Right.
Oh, let's give better care, or let's have better throughput, or let's get better outcomes. It's not specific enough for those front end caregivers to know what to do in order to execute.
Right.
So when I was working in care management, we would segment our population, and we would understand our population from a variety of angles, but I'll use today the example of disease management. We'll just use that. And let's take diabetes as one of those examples. And so the grander scheme is, okay, let's keep these diabetes patients with an A1C of, we'll go at the level of 8 or higher, healthy. That's sort of your broad perspective. But a frontline end user needs very specific goals. They need to know, which patients am I needing to contact with? What are our baseline values? Where are we working from an A1C perspective? How can we prevent them from going into the emergency department so that we don't have that additional cost to their care? And what are all of the pieces that we need to put in place in order to ensure that we're controlling their diabetes and keeping that patient as healthy as possible? So it's moving from this very broad, keep the patient healthy, let's have really great outcomes, to let's control their diabetes, and we're going to do this by reaching out to the patient on a daily basis in this electronic version. And oh, by the way, before the weekend comes, we're going to make sure we have a very specific touch base so they don't land in the emergency room over the weekend.
And being more definitive on what even healthy means, because it could mean something different for different populations.
Have to have that measurable goal of what we're working toward. Absolutely.
Good. So you recently shared how your team unified planning, governance, and reporting to reduce friction and boost visibility. Why is alignment across those areas so critical? And what advice would you give leaders trying to simplify without oversimplify.
Yeah. It's tough. This may have been one of the hardest questions for me to think about
Right.
in how we organize the planning and the governance and the reporting, because when those three things are not aligned, we do have friction and confusion. We've got our planners over here creating this plan. This is what we're going to do. And then we've got the governance team saying, oh, we think you should do it this way when we've got a plan over here. And then we have reporting, which may not specifically be reflecting what the planners say we should be doing. And the governance team saying how we should be doing it. And so with that friction creates confusion, and that's the last thing you want in leadership. It's probably one of the hardest things to really get across when you're working within healthcare, because there are so many varying opinions and workflows and data that we need to organize in order to create this clear picture and execute successfully. So that's what happens. Now, as far as simplify without oversimplifying, it's a fine line, right? And it differs also based on your audience.
I was just thinking it, yes.
Some people need very, very simplified tools. Others can sort of figure it out. So it's knowing your audience and what you need to provide them for their success.
Yeah, meeting people where they are.
Absolutely.
I know this about you, Katie, and that you are a high performer and you build high-performing teams and cultures. So when you talk about fostering high-performing cultures while staying focused on patients and clients, how do you balance high expectations with empathy, especially in high-pressure healthcare environments?
So when I look at high expectations, which all of us have because we're all type A leaders, with empathy, I don't see them as mutually exclusive. I actually see them as benefiting one another. You can, especially when you have high expectations and you meet that with empathy, you're building trust within your team. You have understanding within your team. And as long as you present those high expectations with clarity and they know what they need to do in order to be successful on your team, and they can also trust you to understand the challenges and the work and the diligence that needs to happen in order to meet those expectations. I think it's sort of a best of both worlds. And a leader who can dance in both spaces will have a team that trusts him or her and really is able to perform with the least amount of stress in the team.
Yeah. I was speaking with someone, a lady who I'm going to be interviewing in a couple of weeks, and she works in manufacturing and she works in HR. And she was describing for me the culture and how they lead with fear. And I said that there's no way that the employees are doing their best work because you can't perform if you're in constantly in flight mode, high stress, high anxiety. So that's a great point. And that's especially important in healthcare because you're dealing with care and lives of patients.
Absolutely. Yes. When you have the patient, and it's always about keeping the patient at the center of care. And when you are caring for your caregivers, you'll get the best patient care.
Great. Well said. We talked about transformation being hard, and it is. And resistance often shows up quietly before it becomes visible. I remember specifically when I built up the training team for the electronic health record rollout. And I remember a pharmacist leader in pharmacy calling me and saying, but your trainers aren't pharmacists. And I remember saying, no, but you and your staff are. And you've already gone to school for all of that. We're not teaching you how to be a pharmacist. We're teaching you how to use the technology to do the work that you do in pharmacy. So, resistance. What does resistance typically signal to you, and how should leaders respond differently than they often do?
Yeah. So resistance, I have found in my world, is not necessarily just about people being difficult. It's really taking a step back and listening about what in the system may not be working for them.
Right.
And when we take a step back and understand where the resistance is coming from, oftentimes we can come to a mutually agreeable point where we
Yes.
can then move forward together.
Mhm.
And that's what I think we found in the
Right.
electronic health
Yes.
record. I mean, we listened to the physicians, we listened to the nurses. Was it perfect? Absolutely not. But we were able to continue to work together. So it wasn't about them not wanting to
Right.
embrace the change.
Mhm.
They were having to go through a lot of change.
Right.
And sometimes the workflows just created more clicks for them, and they didn't understand
Right.
how it was going to improve patient care. Part of it was we just hadn't gotten there yet.
Right.
We had to implement first before we could really truly realize the benefit.
Yes.
And so recognizing the resistance when it's there, I think, is the first step.
Right.
Listening and figuring out the reason behind the resistance. People don't just want to be difficult because they want to be difficult. They need some help coming to a solution.
Yes.
And a leader who can step back and listen and problem solve and create unity and a solution where others can benefit is the one who will ultimately be rewarded and accepted as we move forward.
Well said. That is so true. And everything you're describing, while we're talking about it in a context of healthcare and patients, is applicable in any leadership role, in any industry.
Absolutely.
Because at the end of the day, we're all people. So as your roles have expanded and your influence has grown, how has your leadership style evolved, and what lessons have stayed with you the most?
As you mentioned in our initial, in your introduction of me, it took me back here, but you had mentioned a piece about we kind of grew up together. And I thought, that is so true.
Yes.
And when we were growing up together, I mean, I remember focusing on getting the work done, right? We worked these logs, these issue logs.
Yes, I remember.
and it was about, from one milestone to the next. That's how we kind of lived our day. But as I've grown in my leadership roles, I've really moved from just getting the work done and ensuring my team gets the work done to creating an environment where others can succeed.
Yes.
And that's been the most fun piece for me. It's really leading teams where I can develop people on my team to move them to the next spot.
Right.
I don't like, I hope I've not done, but I love to groom people as if they were to take my role.
Yes.
Right?
You should be working yourself out of a job.
Yes. Yes. And that has always been my goal. And I've always, I hope everyone that I work with today knows that I have an open door policy where they can come and talk to me, and I will listen, whether it's about something that happened during the day or whether they want to talk about their career projection. It's one of my passions, and I feel as though, when we were growing up together early in our career to now, where it's really about building that environment.
And it really is. And as I think back, and it made me reflect also about how I've grown. And I've been telling people, because, I'm interviewing, I've been telling employers this: anyone that hires me next is getting the best version of Rhoda.
Yeah.
And it's because what we've gone through, what we've experienced, and what we've learned. And that's why I'm so passionate about wanting to teach about legacy leadership. You don't have to wait 20 years later and make a bunch of mistakes along the way to get there. If the younger generation is open to learning now and shaping their leadership and really understanding something you just said to me, that's when the egg crack, the golden egg cracks. It's when you realize it's about, yes, you get things done, but you're getting it done through others. And
Amen.
so in order to take care of those people, just like you talked about taking care of the caregivers of the patients, it's the same concept. So it's taking care of your people and pouring into them and creating a space where they feel psychologically safe and they can make mistakes and grow and learn from them.
And having conversation.
Yes.
And they feel free to have the conversation with you as a leader. That's a vulnerability.
It is.
Right? To put yourself out there and acknowledge that you might want to do something different somewhere down the line.
Right.
You may not want to stay in the same role for the rest of your career. And we encourage that.
Yes.
We as leaders encourage that.
Absolutely.
And want to develop those.
Yes.
Can you tell them?
Yes.
I'm really getting passionate about
that's
this.
What it really when you said that's the fun part.
It is fun.
It fills your cup.
It does.
I like to say, I like to step back and watch people grow and glow.
Yes.
Yeah.
Oh,
so,
that's a perfect line for you, Rhoda.
So as you look toward the future of healthcare, Katie, what capabilities or mindsets do you believe leaders must strengthen to truly improve patient and population outcomes?
Absolutely. So when I look at capabilities and mindsets, I think it's sort of two parallel lanes that we really need to focus on.
Yes.
We cannot abandon the need of where we are here in 2026 to understand the capabilities around IT and data, technology, and how that influences the care that we are giving to patients today. And a leader has to stay on top of those capabilities so that we are constantly learning those pieces. From a mindset perspective, especially women, we have to embrace our systems thinking, our curiosity, and our ability to adapt. Because healthcare is changing so much. If we can embrace all of those things in this space, in this capability space, as well as put on this mindset of the systems thinking, curiosity, adaptability, and empathy, making sure we bring empathy to the table. I think especially women leaders have a real opportunity within healthcare.
Yes, I agree. Well said. It makes me think about, I wonder now, in a time when we work together, I'm not in healthcare. I know you still are, but on a different side. It makes me think about how we were at the forefront of introducing electronic health records, and now people that are in this space now at the forefront of artificial intelligence.
They definitely are, and they're having to figure it out and how it integrates and how it can really enhance patient care because we're leveraging the technology just like we did 20 years ago.
Yes. Okay, we're going to move into a rapid fire round before we close out. What's one word that best describes the leader you're becoming?
I love this question. Yes. So the word I choose was grounded.
Grounded.
I'm sorry. The word I chose was grounded. I really feel as though I progressed. I have progressed in my career. I've had the ability to take that step back and lead with the clarity and confidence and connection to people and purpose. And
clarity, confidence, and connection.
Yeah.
The 3 C's.
There you go. Clarity, confidence, and connection. But that really has helped me stay grounded. And I hope as I become the leader in the future, I can really embrace, continue to embrace those things.
Yes.
Do I feel challenges at certain points in my career? Absolutely.
Yes.
Do I have some blurriness along the way that I have to work through in order to get clarity? Absolutely.
Yes.
So I am in no way claiming to be a master at all of these things, because the question was, what
Right.
am I becoming?
Becoming. Yes.
But I do hope that I can kind of bring that sense of calm and that perspective as a leader within this
Yes.
space.
Yes. I love that. And I have no doubt that you will become. What's one small habit that's had a big impact on your life or leadership?
So one small habit that I have adapted, I think, and it comes out in different ways, but the premise of it is intentional pause.
Mm.
You probably remember me as an early leader
Yes.
jumping in, having the solution before the problem could even be presented.
I call it the power of the pause.
The power of the pause. Okay, I love it. So, but really incorporating that into my professional and personal life has been something that I have adapted.
Wow.
And that comes by way of my morning stretching routine, where I'm pausing, but it's very intentional, that I am moving through and just taking things in and pausing to think a bit, or whether it comes through my daily prayer as well, and again, pausing to understand the wonderful opportunities that I have in front of me, and then ask for help as I move forward through the day. Or if it's when someone comes into my office and they're presenting me with a challenge or an opportunity, really taking the time to pause and listen and ingest what's going on before reacting.
Such wisdom, such wisdom. The season I'm in right now in my life, I call this the pause.
Yeah.
And I need to be more intentional and in tune to what is the universe trying to tell me and in the path it's trying to direct me on, versus reacting and thinking, oh, I need to hurry up and do this. I need to hurry up and secure something, or this is going to happen.
Right.
Pause. Yes.
Right. And you probably have to tell yourself that
Constantly.
sometimes. Right. I do too. Because we are such go-getters,
Yes,
right?
yes.
We're always going, we're always moving, we're always doing
Yes.
something. We always have to have a list
Yes.
of things that we want to accomplish. And that's why this has to be so intentional.
So true. And then the final question I'll ask you, Katie, is what's one truth you wish every woman would fully believe about herself?
This is a wonderful question, and something that I really loved reflecting upon. And I honed in on the fact that we don't need to become someone else to be worthy of influence.
Yes.
Naturally, we're always working towards something, whether it's the next title, the next degree, the next accomplishment at a job, whatever we're working toward. I hope that women know that they have strengths today, that they can put into action in order to become a really wonderful leader. Whether that's their confidence or being more polished or certain, embrace those things. Embrace them and lead with those things. And I think that that's when women think that they have to be something else or do something more before they can believe in themselves.
Right.
They're delaying the great leader that they already are.
That is so true. Yes. I often say that's why we need to always show up as our authentic selves, because we were uniquely created for a reason. And we were also, your chances of being born are one. I know people hear me say this all the time. One in some gigantic number, 400 billion something. And so you are not only delaying the leader that you already are, but you're depriving others of the gifts and talents that you were meant to give. And you're also depriving yourself.
Absolutely.
So I love that. Thank you.
Keep shining.
Yes. So, Katie, this has been such a powerful conversation.
Oh, thank you.
I
Rhoda.
thank you so much. I appreciate not only your strategic insight, but the way that you center people. I feel your aura and your calmness, and I just, okay, I need it every day. But I feel you in the way you center people, the patients, like you talked about, patient is always at the center, the clinicians, the leaders, while still driving execution and results. And it's so neat to hear the how you've grown as a leader as well. Your work is a reminder that transformation doesn't happen through vision alone. It happens through alignment, discipline, and leadership grounded. Didn't even know that was going to be your word. In both clarity and compassion. So thank you so much for sharing your perspective and caring enough to do so.
Oh my goodness.
And your story with us today. And to our listeners, thank you for joining this breakthrough conversation. If today's discussion resonated with you, I encourage you to reflect on how strategy, systems, and leadership show up in your own organization and where alignment could unlock greater impact. Until next time, remember your breakthrough begins here.
Hey, what's your secret? You got the kind of vibe that leaves you speechless. It could be model multitasking genius. Yeah, you got it all. Hey, what's your story? A kick-ass mom and 40 under 40. A soccer practice in your high heel glory. Yeah, you do it all.